All right, this is the big breaking story. We're tracking the two COVID-19 cases of the Omicron variant that have been detected in Karnataka. That was the Karnataka Health Minister indeed confirming what the Health Ministry, the Union Health Ministry, told us about 2 hours ago. The two men, aged 46 and 66, are the two confirmed cases we know so far. However, what we're learning is that these cases were detected more than a week ago. They were mild cases, have been discharged from hospital. They've both recovered. In fact, one of the patients, who was a foreigner, has returned back to Dubai after testing negative. So we're learning of these two positive cases of Omicron essentially only a week later. Dr. Subhash Salunke, member of the National COVID Task Force and Senior Advisor, Public Health Foundation of India, is joining us. We also have Dr. Rakesh Mishra. He's a microbiologist and director of the Tata Institute of Genetics and Society. Thank you both very much for being with us. Dr. Salunke, to you first. The question here is why this delay? This patient number 1 tested positive after returning from South Africa on the 20th of November. The genome sequencing, how long does it typically take? When would we have known that this is the first positive case of Omicron?
Yeah, actually, I am not really unduly worried, nor I am surprised that we have got cases in one of the states in India. It is 100% guaranteed that we are in pandemic, and such whenever the mutant variants are going to come out, and in just span of 4 days, when 25 countries are infected or affected or whatever word you want to say, and if we get 2 cases in India, skies have not fallen, number one. Number 2, sequencing certainly requires a processing part, at least 6 to 7 days. That is what is needed by our virological laboratories. And that is the reason they have taken some time, which is quite logical and quite scientifically correct. So I think what is, what the Honorable Health Minister of Karnataka was trying to explain is that number 1, first and foremost, that hype and the panic and as if something terribly is going to be wrong in a day or 2 in this country, let us get rid of that. Yes, the newer mutant has come. 2, it is bound to come to various countries, so it has come to India.
You're saying there's no need for panic, the skies have not fallen. In fact, the 2 patients, that's what we're saying as well. The 2 patients have recovered. In fact, one of those patients has tested negative and left the country also.
Yeah,
so we're stating the
South
facts
Africa.
as is. But my question to you is, if it takes, so no, he came from South Africa via Dubai, tested negative and went back to Dubai. That's what we're reporting at the moment.
No, I'm trying to indicate that even in South Africa, the situation is not something abnormally that virulence is very high. It's the very mild cases that are occurring, and that is a very positive point. And India has a special ability to deal with this because we have a natural infection.
Right. No, that's fair. That's fair. Your point is well taken, that so far what we're reporting is that thankfully these are all mild cases. But Dr. Mishra, explain to us, the chronology of events. I mean, if this patient number 1 landed on the 20th, how long would it have taken to detect that he in fact was infected with Omicron? How long does this genomic sequencing take? Because some experts who've been here on NDTV have said that it takes about 36 to 48 hours.
The sequencing process itself takes, actually it can be done in much shorter time, but there's a process. The sample will arrive, then somebody has to process, there's library preparation, then you load on the machine and it runs, and then when you see something unusual, there's a lot of time goes in analysis because you don't want to announce something which is not confirmed, and when it's something of this kind, I'm sure they may doubly confirm these things. So 48 hours is the average time we put. And I do not know the when sample came to which place and all, but I think we should not get too much concerned about it. The fact that we have identified, which was very much anticipated, when it's in 24 countries, it must be there in many places. And as you heard the minister saying, because of the robust surveillance, they have picked it. And
but Dr. Mishra, my question is, isn't time of the essence here when you're reporting a strain that's thankfully, so far, like Dr. Salunke was also explaining, they're mild symptoms. Both these patients had mild symptoms. Thankfully, both patients have recovered. They've tested negative. The question is, isn't time of the essence? Shouldn't we do genomic sequencing really quickly to identify Omicron cases, isolate them in order to stop that rapid transmission? So, if time is of the essence, Dr. Mishra, how much time does it typically take from a sample testing positive to actually us identifying whether this positive sample is Omicron?
If you are doing the same thing in the same lab, there are a lot of logistics involved in this. If sample test positive in a lab, now then it goes to a process, then they say that, okay, send a sample to a sequencing lab. Then it will go to a particular sequencing lab. Depends on when it reaches. Sequencing is very expensive process, and sequencing is generally in batches. You sequence several hundred in one go.
Yes.
So it depends, and nobody knows which one is Omicron positive, negative. If each sequence, each sample has to be given priority, then the cost will be just prohibitive. You cannot do it. You can afford it only when you do large number of samples in a go. So we are talking about something very large scale, and where this kinds of couple of days delays is understandable.
Okay.
And after all, these are people who are doing.
But Dr. Salunke, does this essentially mean that we knew about 48 or 72 hours after these people are tested positive that these were cases of Omicron? Because clearly they've recovered, they were isolated, they've now tested negative, and they had only very mild symptoms.
True. The fact remains, it is actually the post facto kind of a thing, that the samples have been taken, these guys have been recovered, and now after sequencing we have come to know. Had we not done sequencing, we would have just said that, well, they are positive, nothing beyond that. And as a matter of fact, Rishika, let me assure you that this delay of a day or two or 36 or 48 hours is not going to cause any serious adverse impact.
But then should all positive patients be kept in isolation till their genomic sampling is done? Is that what needs to be done going forward?
That is what is being done right now because of the, the instructions that have been issued by Government of India for international travel, particularly from the countries which are considered the high risk. So all these guys who are coming from these countries, they are being quarantined, they are being, the testing is being done. And then after that, if there are going to be positive RT-PCR, then sequencing is being done. So this entire process is going to take. But again and again, I'm trying to tell you that there is a limit to which these all processes will stop the transmission of this virus within India. It cannot guarantee. Nobody can guarantee by doing all these things that will stop the transmission.
Yes. Should we be worried that one of the two patients actually doesn't have a travel history?
Oh, certainly we should be worried. The fact remains that means the transmission that has taken place in the number one, as far as epidemiological, full investigation must be done so as to identify what is the source of infection then. If this person doesn't have a history of travel, from whom this guy has picked up this, obviously the virus is there, and that's how this person got infected. So the fact remains that we need to understand why this is happening, and that epidemiological investigation is very critical.